Good morning, everyone. Welcome to the fifth and final day of the 7th One Health Congress. I'm Ruki Dialvis, Deputy Director at the Duke-NUS Center for Outbreak Preparedness. The past 4 days, we have learned from subjects ranging from infectious disease surveillance, AMR, human-animal health, vaccines, environment, climate change, science-based policy, global financing. The list goes on. We have learned that One Health is complex, multi-sectorial, and vital for pandemic preparedness and response, which brings us to the first talk this morning by Dr. Maria van Kerkhove. As we saw from yesterday morning, Dr. Maria does not require an introduction among this audience. However, I do want to highlight that in addition to being the COVID-19 technical lead at WHO, she also leads the WHO's work on emerging diseases and zoonosis, which makes her an ideal person for this talk, titled Pandemic Preparedness, Readiness, and Response, using a One Health approach, celebrating successes, addressing challenges, and working together. Please welcome Dr. Maria van Kerkhove.
Thank you very much. Good morning, everyone. So I recognize that I do have experience in emerging diseases and zoonoses, but I am amongst giants in this room. So I know the audience who I'm speaking to, but it's a real privilege to be with you today. So I'm going to try to keep to about 25 minutes so that we have time for questions. I'm looking at the organizers here. But essentially want to frame where we are. So I think it's quite clear. Let me make sure that the video will play, that over the last decades, the last several decades, we've had numerous opportunities for viruses to cross the animal-human species barriers. And we've had epidemic after epidemic, and we've had several pandemics, at least 2 in the last few decades, and we expect there to be more. But with recent outbreaks of Ebola, of Zika, of Marburg, avian influenza, continued outbreaks of MERS and cholera, we expect this to continue. So you all know that we live in this interconnected world between humans, animals, the environment that we share. And there are so many different factors that are making the risks for emergence and reemergence higher. So in this interconnected world that we live in, there's so much work that actually needs to be done to evaluate why this is happening. So there's pathogen after pathogen, and each of the different types of viral families that are out there, and bacteria we can't forget, there is the next disease X. So COVID-19 was disease X, and we expect there to be another one, at least in our lifetimes. And we live in an interconnected world. So any pathogen that can emerge in any location around the world, given how interconnected we actually are, could be on another part of the planet very, very quickly. So for us, what is really critical is that we look at the drivers of spillover, we look at the drivers of amplification, and that we continue to work on addressing these. I recognize, you all recognize in this room how incredibly challenging that is, particularly in the current climate, and I will come back to this at the end of my talk. But this is something we are invested in as the World Health Organization, working with our partners, making sure we have research that is comprehensive, making sure that we have individuals that have the space to work. And again, in this world that we live in, we expect that these types of outbreaks will continue. But the question we have is, there's known threats that we have, and this is just an example of a map that has been created to illustrate that, to demonstrate that we have these threats around the world. And what you can see on the right-hand side of this slide is the current graded emergencies that WHO is working on at the moment. And the number is really hard to see if you can see this, but there's 52 graded emergencies that WHO is currently working on. We evaluate thousands of emails every week going through something that is suspected to be of concern or an alert, many of which require field investigations, many of which require follow-up. So it's a concerted effort. But what we want to look at right now is, where is the next emergence or re-emergence? And what we would like to do is enhance our preparedness efforts through improved data analytics. Now, many of you in this room have spent decades working on understanding these risks, understanding zoonotic spillover, understanding amplification. creating maps to help us better prepared. We would like to reevaluate all of these maps and in fact pull them together so that we look at the composite risks of spillover, not a MERS map, not an Ebola map, not a Nipah map, but actually look at the composite risks of all of the zoonotic pathogens at a local level to be able to be better prepared to predict when these may happen and to have communities better prepared to prevent them from happening or mitigate them once they do. So we're working with IHME at the moment to look at the different components of risk to remap spillover and amplification, taking into consideration many of the different types of factors related to animal reservoirs, related to vectors, related to the populations that live in these communities in terms of their demographics and their profiles, the capacities to be able to detect and to respond. And there are many different sources of information that are available. So we're not starting from scratch. And in fact, I would love to make an offer to anyone in this room who would like to work with us on this particular project. The idea is not to have maps, to have pretty maps. The idea is to have a map that is interactive, that could be linked to ongoing emergencies, known emergencies, capacities that exist on ground to be better prepared going in the future. But I predict that when we have these maps published, every one of you will come up and say, these are not so great. What I would like you to do is come to the table and say, there's more information that can be used to make these maps better. So please make sure you reach out to me if you would like to be involved in this project. So there's many more opportunities to be prepared. And the way that we're looking at this is we're looking at viral families. So we want to look across different taxonomic groupings, across different types of transmission routings, across different syndromes, and across intervention groupings like vaccine preventable conditions. So again, there's a lot of opportunities to be better prepared here. We recognize we're not starting from scratch. We want to build on all of the work that you have been doing over many, many decades and make this better. And collaborations are key, remain key. So we are engaging global data collectors and resource generators, making sure that we work with local actors to increase awareness efforts and make sure that we meet global needs and local needs. So at the moment, we're working on a proof of concept of this composite type risk mapping. Once we have these global maps illustrated, we will be identifying several different countries so that we can go into more detail and look at these at provincial levels and see how the maps can be even more improved. So again, please reach out to me if you would like to be involved in this. But the goal is not the map itself. The goal is to be better prepared at local levels. And what we want to do is we want to look at this local level, looking at the emergence, the time of spillover, move the clock backwards in time so those events can actually be detected, improve our surveillance activities, improve the people who are in these villages themselves. I am highly impacted by my time in Cambodia, where I was there for 2 years doing my PhD, and there were village animal health workers working in the village itself who recognized something that was different when poultry died off. It was a different time of the month or a different time of the year. There was a different proportion that died. And then there was a alerting system, and that triggered and cascaded a lot of events in terms of recognizing and alerting the district vet, the provincial vet, health officials, so that investigations could take place at the local level. But again, building outwards, the idea is to contain at the source, if that is possible, and make sure that we protect the communities that live in these areas to be better prepared and have them better prepared, enabled, and empowered going forward. Another small project that we have that's ongoing right now is with Prezode, and I hope there are some people from Prezode in the audience here, looking at certain metrics that can track reduced risk, because what's measured gets done. So we just issued a call for a working group to bring people together to be able to identify these metrics that we can track over time, to be able to say how well is a country prepared, how well is an area prepared to reduce the risk of emergence, to reduce the risk of a future outbreak or a pandemic. So this expert working group will be working over the next year or so to identify some of these metrics. And again, we will be reaching out to you for some inputs on that. So some other key initiatives that we have, which I want to just take a few minutes to mention to you, is strengthening of the global health architecture in emergencies. So I think it's demonstrated, again, how outbreaks can be incredibly have impact beyond health, not only have an incredible health impact, but have a devastating economic impact as well. So we know that we have a reported 6.5 million deaths of COVID-19 to date, but that number is probably at least 3 times higher. And of course, the secondary type, the excess mortality that we're starting to see in countries right now makes deaths even far higher. So the impact in terms of mortality, morbidity and mortality is massive. But not only that, we have this virus, this pandemic, has impacted our economy with about 16 trillion estimated revenue loss in the international sectors. 1.6 billion children out of school, and in some countries, schools are still not open. Some areas, schools are still not open. There's been a 30% decline in the investment in clean energy, and we have at least 135 million more people estimated to be pushed into poverty by 2030. So devastating impacts. You in this room know this very well, but I think as health professionals, we need to talk about the risks of the work that we do on these types of pathogens, using this One Health approach, but talking about not only the impact on lives, but the impact on livelihoods. This resonates more with funders, with politicians, unfortunately, but I think we have to frame this. Because we want an all-of-society approach to dealing with epidemics and pandemics, we have to talk about an all-of-society impact of each of these types of outbreaks. So pandemics are increasing in frequency, and I hope I am wrong, but we will likely see another pandemic, certainly in our lifetimes, and we have to be prepared for that. We don't need everyone on the planet to be worried every day that this is going to happen, but those of us who work in this field need to be able to do our jobs to make the world better prepared. So the Director General of the World Health Organization, Dr. Tedros, presented 10 proposals to build a safer world, building on a lot of independent reviews that we've had over the past several years, and in particular during the COVID-19 pandemic, where we have synthesized more than 300 recommendations that have been made to us and to others. And this has been developed in consultation with member states, with partners, and it was presented at the World Health Assembly in May 2021. There's a document online which outlines these 10 proposals. And what we are proposing going forward is strengthening of the global health architecture for emergency preparedness, response, and resilience. We call this HEPR, with 3 main areas of work that need to be focused on: governance, systems, and financing. So this is what will be discussed under this pandemic treaty or this pandemic accord, which to me is quite a promising, hopeful sign for the future. We need to be in a better situation for the next one than we certainly were during this one. So again, nothing new to anyone here in the room, but we recognize and we need to be better at communicating that this is important, that we engage all of society and that we embed the systems within strengthened health systems, not existing health systems, but strengthened health systems, and certainly not the health systems that existed before this pandemic, because so much work has been done in this space around the world where these systems have been strengthened, and that's what we want to maintain. So it's not just health, of course. It's linking animal health and architecture, economics and financing, social welfare and protection, disaster management and national security, the environment. And all of these intersect in the area, in the space where we need to be thinking about going forward. And having a strengthened global health architecture takes all of this into account. And this needs to be grounded in resilient communities and primary health care. So we talked yesterday about how outbreaks begin and end in communities. I don't think we can say this enough. This is not an afterthought. This is the foundation by which we do all of our work. And again, you know this in the room. So all of these health emergencies begin and end in communities. And the idea is that if we have stronger communities, better prepared communities with the supporting systems around them, then we can do a better job of preventing these small events becoming even bigger. This requires resilient communities and strong primary healthcare systems supported by national, regional, and global networks for prevention, preparedness, readiness, and response. And all of this, of course, is underpinned by the IHR core capacities and interconnected capabilities. So you'll hear more about these 5 C's, which are illustrated on the right-hand side here, of collaborative surveillance, community protection, safe and scalable care, access to countermeasures, and emergency coordination. This is how we are thinking about even COVID-19 now, many of you have been involved in the 10 pillars of the response that was outlined in the Strategic Preparedness, Readiness, and Response Plan for COVID-19. We're shifting this into these 5 C's, if you will, because they're interconnected. So that we're not focusing only on COVID-19, we're focusing on respiratory disease management, dealing with the acute objectives now of ending the emergency everywhere, but building a strengthened system for dealing with respiratory pathogens as we go forward. There's a lot of work involved in this. It's a little bit of a change in a shift, certainly at a global level in terms of how we think of this, but I hope that these types of C's, these 5 C's, resonate with you in the areas where you work. And what we want to do is we want to leverage and expand our partnerships. Again, we're not starting from scratch. There is an epidemic of new initiatives that have happened, many of which will not be sustained. But there are a core group of incredible partnerships that we at WHO have across the UN, with our partners in the animal sector, with FAO, with WOHC, with UNEP. But there are many different initiatives around the world. We have an incredible GORN network that we've been working with for the past 20 years, academic institutions, public health professionals, and we want to expand and strengthen these, so that we have strengthened national and sub-national core capacities supported by global and regional technical and operational support models. So again, this is an investment that we need to spend much time in and nurturing, investing in, and building for the future. There are many individuals that are in this room that are you're in your early career. You are the future of dealing with these pathogens, dealing with these crises as we go forward. And we need to do this through the tools and technologies that exist and will be developed. We need more resource allocation for this and financing, and I'll come to this later. And we need to ensure that learning capacity continues, because in the field of science, we never have enough information, we never answer all of the questions. So research and innovation needs to be supported, and we need to measure our impact. We need to be held accountable for the responsibilities that we have. So we would like to see a world that is on alert, but that is ready to deal with these emerging threats. And the earlier we can act, the earlier we can work to prevent something from happening, prevent an animal spillover event, or if that does happen, to be in a better position to detect it and to take action, the better we can be in preventing things that actually need to be contained, controlled, and mitigated. So there's a lot of work that's happening right now in terms of financing in this fifth, on the prevention and the prepare side. And this is a good thing, because prevention is not as sexy as response in that sense. It's very difficult to talk about what was prevented, to say we averted these cases from occurring, we averted these outbreaks from happening, but we need to change that narrative, because it's a much better situation to prevent something from happening than have to respond to it and see these devastating effects around the world. So I'm at a One Health conference, I'm with all of you in this room. Again, reiterate the very strong global commitment that we have for One Health. I find it quite fascinating, you may in the room as well, how One Health seems to go through these fashionable phases. It's quite fashionable again. Let's take this opportunity to really push this agenda going forward, because this is not anything new. This is something that you have all been working on for many, many years, but we have an opportunity now to really take this and catalyze this going forward. I won't spend time talking about the One Health Joint Plan for Action, because I know you had many presentations of that over this week. This has been launched. This is something that WHO and our partners are committed to ensuring, so that we have a better world that is protected, and working with communities and countries to implement this at ground level. We want to leverage existing tools that exist. We don't need to reinvent the wheel, but we need to utilize these tools and make them better. So there are many that are out there. There's risk assessment tools that have been in operation that are being improved every day. And again, we need your support in being able to do that. There are more tools that are coming online in terms of mechanisms to make sure that we work closer together. And that is something that we're committed to doing. So the tripartite, now the quadripartite, has many different types of technical collaborations around the world, but we need to see these tools implemented in countries so that we can operationalize this One Health approach in countries directly. Just a moment on talking about some of the networks that WHO has. So we have incredible people that we work with. One of the things that has grounded me during the last 2.5 years, and even before that, but really focused on in the last 2.5 years during this pandemic, are the experts that we work with around the world. So a lot of people have said to me, Maria, in this pandemic, how big is your team? How many people do you work with? How big is your team? And quite frankly, my team is thousands of people around the world, because all of you work with us. I have very rarely been in a situation where I have asked an academic institution, a public health professional, a ministry to do something for a public health benefit and been told no. And that to me is quite inspirational, because we all have the same goal. We all want to be working together to be better prepared. We all want to be working together to have a better response. And to me, that is encouraging. Science during this pandemic has been an absolute triumph. How scientific tools have been utilized, well, that's a different question. And one could argue that that's been quite a failure if we think about vaccines, if we think about therapeutics. But scientific collaboration is strong. And scientific collaboration transcends any politics, any election cycle, and I thank you for that. So one of the things that we are doing is looking at our technical advisory group. So I mentioned some of the ones here. There are many of you in the room who are part of our One Health high-level panel, which to me is such an exciting expert group, bringing together professionals around the world, looking at these high-level issues related to One Health, very difficult challenges. And I hope that this group will be holding institutions, holding agencies, holding organizations accountable to tackle some of these major critical crises that we are facing. We also have our STAG-IH, which is a technical advisory group on infectious hazards. They recently have been relaunched. They have updated terms of reference, and they met in Geneva, and many of you who are part of STAG, some of you are in the room, and we're grateful for the work that you do with us. We have the SAGO, and I'll come to that in a moment, which is a new advisory group. Actually, it's about a year old, looking at addressing studies and providing a global framework to better understand how these pathogens cross the species barrier each time we have an outbreak, so that there's a new standard, so that there are expectations. You in this room know what needs to be done when there's a spillover event, but the world doesn't necessarily know how comprehensive and how difficult that is to actually conduct. We have a technical advisory group on biosafety. Again, I know some of you are in the room, and I see Kaz back there, who works with me at WHO, who is leading the secretariat on that. We have a technical advisory group for arboviruses, and these are just some of the advisory groups that I mentioned here. But again, we are really grateful for all of the groups that work with us on this, and there's quite an important mandate that they have. So just a moment on SAGO, because I think some have a misunderstanding of what this advisory group is. This is a scientific advisory group for the study of origins of novel pathogens. And in the context of the threat of emergence and reemergence of these pathogens with epidemic and pandemic potential, and particularly during this pandemic, we as WHO recognize that there is no global framework to study this. There is an understanding that it needs to be comprehensive, there needs to be an overview, but we've never brought together all of the different elements in a framework. So this group has been brought together to do this, to identify and to outline a global framework to study future emerging and re-emerging pathogens that is comprehensive and coordinated, that has a holistic One Health approach, studying this from the environment, from the animal-human interface, through environmental safety, and all the way through biosafety and biosecurity aspects in labs, and to establish this framework that can be used each and every time this happens. So the Director General asked for this scientific advisory group to be established. I am currently running the Secretariat, and in fact, we've just opened up a position at WHO for someone who would like to help me do that. So please look at our job site if you are interested in doing that, because this requires a lot of attention. We have an incredible chair and vice chair. Marieke Venter is the chair of it, and I know she's here. And this is a dedicated group of 27 individuals from 27 different locations around the world. These are not representatives of any countries, but coming together work on this. They also have the task of looking at how we can better understand the origins of the current pandemic, which is very difficult to do at the moment. So I have a couple of last slides here. We want to recognize that the last couple of years have been incredibly difficult for all of us. And there are improvements across every single one of these 5 C's. But there's much more work that needs to be done. I could give you examples of how surveillance has improved. Surveillance in animals, in wildlife, surveillance at the animal-human interface, surveillance within the environment of looking at wastewater, which is something that has been very helpful for COVID-19 and SARS-CoV-2, and looking at the extent of circulation of this virus. But much more work needs to be done. There's a huge amount of increase in testing capacities around the world, but that is under threat at the moment because there is no fiscal space, there's no financing that can sustain the amount of testing that is done. That's not necessarily a bad thing. What we have to do is calibrate. What is the right amount of testing that is needed for pathogens, zoonotic pathogens with epidemic and pandemic potential? Not to just have a SARS-CoV-2 lens, but to utilize a workforce, an infrastructure, a system that could be used for pathogens that threaten our societies. Sequencing has massively improved around the world. More coordination is needed to ensure that the financing that is available for this is being given to regional networks, countries, subnational levels, so that sequencing, metadata, bioinformatics can be utilized at local levels, can be shared globally so that actions can be taken. A lot of improvement in risk communication, community engagement, but misinformation, disinformation massively threatens us. It threatens any scientific advance that we have. And this is quite concerning to me at the moment. You can have incredible, safe, and effective vaccines, but if they don't reach the arms of the people who need them because of misinformation and disinformation, they're useless. And this is something we have to deal with going forward because we expect this trend to continue. We see incredible clinical professionals, medical professionals, community health workers around the world, but many of those individuals who are leaving. Many of them are suffering from post-traumatic stress disorder because of the last couple of years. This workforce needs to be trained, it needs to be protected, it needs to be supported as we go forward. So a lot of work in that space. And I could go on, but I want us to recognize and take stock of the fact of how hard everybody has worked in the last couple of years, but recognize our work is not done. And I think you all know that, and I think the exhaustion, the collective exhaustion that we have is something that we're gonna have to push through and figure out ways to sustain. And we are committed to supporting in doing that. But I wanna end on some caution because we do have quite some concerns going forward. One of the things we don't see enough, we talked again a little bit about this yesterday, is addressing incentives and disincentives for all of these actions. If we take, for example, surveillance, if we take, for example, looking at identifying the next disease X, I would bet every single one of you in this room has felt some kind of threat in that space, some kind of concern about the work that you do. I, for one, was absolutely not prepared for this pandemic in terms of the personal threats that I have received, the threats against the organization, for the work that we do, my life threatened, the life of my children threatened, for trying to do our jobs. And I am sure many of you, and I know many of you in the room, have had similar threats to yourself. But we need to address all of the drivers of this. We need to ensure that scientists and public health professionals have the space to do your jobs. This is something that we are committed to. This is something that I am personally committed to. You need to be able to do your jobs responsibly, safely, robustly, collaboratively, and transparently. And I'm quite concerned in recent months with some trips that I have had in talking directly with researchers where you feel threatened. Your work feels threatened, your labs feel threatened, your financing feels threatened, given the misinformation that is circulating, the disinformation that is circulating, and certainly the geopolitics of the world that we live in. So this, to me, makes me quite concerned, because if you can't do your jobs, if you can't generate the data, generate the analysis, discuss, debate fiercely, which I really appreciate because science is complicated, and share that information with organizations like mine, like the World Health Organization and others in this room, I can't do my job. We can't do our jobs, and we're in a worse situation going forward. I do want to be hopeful, though, because I think that there's new technology. I think that the collaborations that are in this room are inspiring, but it is something we have to be cautious about. So it is important that we, as collectively, provide you with the opportunities to do your work. And I encourage you to, again, keep at it. I encourage you to keep going. We will encourage funders to ensure that you have sustainable financing to go forward so that you're not working on 3 months, 6 months. And funders, and a special thank you to the funders who continue to fund this work. But we need the work to continue because we need to be better prepared going forward. And we want sustainability in the workforce itself. Sustainability through trainings, through opportunities, through the financing. And we need to see more coordination in this space. There's a One Health epidemic in terms of all of these new initiatives. These need to be nurtured, these need to be connected so that we can all work and sort of enhance what we're doing. So thank you very much for the opportunity to speak with you today, and I hope this was helpful.